Hello and welcome to this session of the University Mental Health Charter Programme. And today our topic is creating a whole university approach to mental health and wellbeing within our communities. This recording is the introduction to the facilitated discussion and workshop that we'll be holding online to look at this topic. But do feel free to share it with colleagues across your institution if you think that would be helpful. We want to have these conversations as broadly and as widely as we possibly can. And hopefully it may help to facilitate some of those discussions and to help colleagues understand what we mean when we're talking about a whole university approach and what we might be looking for when we come to the point of you applying for the Charter Award. My name is Gareth Hughes. I'm the lead author of the University Mental Health Charter, and I will hopefully be seeing you all in the workshop when we have our facilitated discussions on this topic. So what we're going to look at today, very specifically, we're going to try and tease apart what we mean by a whole university approach. That phrase gets bandied around a lot, and it has very little specific meaning, I think, unless you've read a lot of the academic papers. So we're going to dig into that a little bit more and really try to understand what we do and what we don't mean by a whole university approach. And then when we'll look at what some of the implications of those things might be for universities. And then when we meet in the facilitated discussion, we'll have a deeper dive into some of the key questions that arrive from all of that, things like who needs to be involved, how to ensure your university approach is successful, how you engage leadership, and the detail that you really need to be paying attention to make sure your whole university approach really is reaching down into all of those areas that it needs to. So I'm going to talk through some of these things in this little recording, and then when we come together, we can discuss any of the things that are raised, any of the questions that come up in your mind, and then we'll go through some very specific discussions and questions to help you think about your own whole university approach, how you might want to apply it, and how you might want to have discussions with colleagues back in your institution. We're really keen in those discussions to hear from you as well about what it is that you've done, because we know universities have been working on this for quite some time now. So we're really keen to help share good practice amongst colleagues from across different institutions. So we want to hear from you about what's gone well, what have you found, what were the barriers that you faced, and how did you overcome them? Because through all of that, we can then start to build up a real sense between all of this about how we can go about doing this and build up an understanding of what good practice looks like, because you understand and know as much about that as we do. So we're really keen to hear from you. But let's dig into our topic for today and let's look at what we mean by the whole university approach. Now, let's start by thinking about why is it that the Charter so specifically sets out the importance of a whole university approach. And that really is because of the relationship between mental health and well-being and everything we encounter in our day-to-day lives. If you look at the research, we know that everything we come across in our day-to-day lives, including our own thoughts, our own behaviors, the environment we're in, other people, how we react to them, our own understanding of ourselves, the quality of the social connections that we have, all of these things have an impact on our mental health and well-being, many of them outside of our own awareness. I mean, some of the research, for instance, that shows the impact that nature can have on us, very often operating at an unconscious level, but just being in nature, being around the natural world, being around trees and grass and animals has been proven to have a really positive effect on our well-being overall, whether we're aware of it or not, whether we're paying attention to it or not. So what that means is we really need to be thinking about everything around us if we really want to think about how we improve mental health and well-being. What it also means is it gives us many, many points of intervention. Having a settings-based approach, as it's called formally, means we can think about lots of ways of positively impacting on the well-being and mental health of our staff and our students, and also of looking for where things may be going wrong. What are the things that might be having that negative impact that we can then do something about to address? And so what that means is that the evidence very clearly shows us that we need to think about our environment in the round, everything that could be potentially impacting on us. And so that means thinking about the physical environment, that means thinking about the cultures in which we find ourselves, socially how we relate to each other, and personally about what's going on for us individually. Now, there are many ways of actually breaking down what that actually means. But one of the things we can take from that is that every university already has a whole university approach to mental health. It just means that some of what we're doing, we've thought about and planned for, and is hopefully having a positive effect. And some of what we're doing, we won't even have recognized as having that impact, but that it will be doing it anyway. So we may not have thought about our physical environment, but whether we thought about it or not, it's going to be impacting the well-being and mental health of our communities, potentially positively, potentially negatively. And that's true for every aspect of university life. So everything we do, whether we've thought about it or not, will be having an impact on our mental health and well-being. So our aim then is to consciously think about all of those parts of university life, all of those aspects of what it is to be a university, and to think about the ways in which they might be impacting on staff and students, and what steps we can take to enable those things to have a more positive impact as we move forward. So I guess we'll stop there just for a moment, just for you to think about. So within that context, just think to yourself about what it means to you, and also about, are there any concerns you have about the whole university approach? Because one of the things we need to be aware of is that there have been a number of concerns raised about what a whole university approach might mean. Some people have worried that this might mean less of an emphasis on the services that we provide to staff and students, and then it might mean taking away funding or resource or just activity in that area, which hopefully if you've read the framework document, you know that that's not what we mean, but there are concerns that that's what it might mean. There are also concerns that it might mean a kind of overall dilution of the whole focus on mental health and well-being to the point where it kind of becomes meaningless, where it doesn't really mean anything at all. So just for yourself, take a moment or two, and you might want to pause this video just to think for yourself and note down, what does a whole university approach mean to you? What's your interpretation of this? And maybe what are your colleagues' interpretations of this? What's your view of what the balance is when we're looking at a whole university approach? So having thought about that, I want to just move on and look at some of the ways in which this might be conceptualized that I think are consistent with the way we've thought about it within the Charter framework. One of the things we're very clear about is the way we put this thing together in the framework document is just one way which fits with the evidence. There are a number of other ways you possibly could have done this that would still have fitted with the evidence overall. But I think recognizing that you can think about it in a number of ways that still are consistent with the Charter overall, I think it's quite useful, because one of the things we're very keen on is helping universities to really think about your context, because what a whole university approach means for one university is going to be very different for another. What it means for a big post-92 university is going to be very different if you're a small specialist university, or if you're maybe a smaller selected Russell Group university or a cathedral school. So we really want you to think about, what does it mean in your context? What's the model that's going to help you explain this to your colleagues? Because that's another thing. People grasp different models sometimes. So we're going to have a look at different ways of looking at that, all of which really you can find within the Charter framework document. So the key defining phrase you find within the framework document itself is this one, which is when we talk about the fact that a whole university approach must include adequately resourced, effective and accessible mental health services and proactive intervention. It must provide an environment and culture that reduces poor mental health and supports good mental health, and that facilitates staff and students to develop their own insight, understanding and skills to manage and maintain their own well-being. The way I like to think about that, just to help kind of conceptualize that a little bit more, is I think about it as the three legs of a stool model. In that what we're actually trying to do is, if we think about the beginning, we want to create an environment which is healthy. We want an environment which is naturally conducive to good mental health and good environment, in which people have good relationships, in which the expectations placed in them are healthy, in which interactions are healthy, in which the things that they encounter, in which the physical environment helps to promote good mental health and well-being overall. So that we have just a general environment and culture which is positive and good for mental health and well-being overall. Alongside that, the next leg of the stool is that we are proactively working with our staff and students to help them develop their own resources, skills, knowledge, understanding to maintain and look after their own well-being. Because of course we all have an individual responsibility as well. Now that individual responsibility is only one part of this. Again, one of the debates that happens very often is about, well, how much is individual responsibility and how much of this is structural? And the fact that sometimes when we look at, well, what do we do proactively, we can ignore the structural stuff that's impacting on people. And that's when we start talking about things like resilience in ways which can be actually quite harmful. We start saying, well, the individuals need to be resilient, and ignore the structural factors. And what we're seeing here from this three-stool model is the structural and environmental and cultural factors are absolutely important. But even within a healthy environment, as individuals, we need to also be adopting healthy practice and healthy behaviors and healthy thinking, because our own behavior can cause problems for our mental health and well-being, even if we're within a healthy environment. So we need a healthy environment, and we need to empower people give them the resources, the insight, the skill, the opportunity to self-reflect and to develop and to grow so that their own mental health and well-being, our own mental health and well-being is really good. And then alongside that, we need to acknowledge that whatever we do with the environment and however much we empower people, some people are still just going to develop problems with their mental health and well-being because of things outside their control and outside our control. And when that happens, we need to ensure that we're providing safe, effective services that they can access quickly and get the support that they need so that they can hopefully return back to health and well-being or recovery, whatever that in whatever way that means for them, or whatever recovery looks like for them, depending on their circumstance. So we need to be thinking about all three of those aspects, and it needs to be in balance. Because if any of those three areas are neglected or don't exist, the stool collapses and ceases to work as a stool. So our whole university approach only works if we think about all of those three areas. Now, within the Charter, we've developed this out and broadened it out much more to think much more specifically about what's going on within university specifically. So the next level at which we've looked at that is we've looked at a number of dimensions and a series of enabling things. And this matches to the update of the UK Step Change Framework, the Mental Health Universities Framework. And we worked very closely with Universities UK to make sure that these two things were still speaking in one voice. So we have those four dimensions: learn, work, support, live, and then a series of enabling things. And those enabling things are the kind of areas of university life that cut across everything. Things like leadership, which cut across everything that we do. And then within those dimensions, we have a number of themes that we've pulled together. So you might, and you're thinking about a whole university approach, it may be useful to you to sit at this level with some colleagues and to talk about these kind of 5 areas, the learn areas, so that we need to think about how students are learning and how they're engaged with their learning, that we need to think about what support we provide, that we need to think about the work aspect for staff, we need to think about how we're creating a culture and an environment and training and support for staff, and the live area, that kind of the living within the environment and culture. How do we make sure that's okay? And then how do we ensure that all those foundations are in place to make sure that our whole university approach is solid and is built on things that are going to make sure that it endures? But you may also want to dig a little bit deeper into that and to look at the specific themes. And certainly within your whole university approach, when you're thinking of applying for your Charter award, you really need to be going to the individual things, because we'll be asking you about each individual theme when it comes to that point. So within the learn domain, we look at 3 areas. We look at transition into first year, and we know that that's really important. How we support students into the university and support them throughout that first year. Absolutely important, because a number of things happen in that early area. First of all, sense of belonging, really crucial. We know for some of the students who may experience problems, so those groups of students, so Black and ethnic minority students, for instance, in those first 6 weeks, that sense of belonging can weaken, and that then impacts on their overall experience of being at university. So we need to be thinking very carefully about all of that. We also know that health behaviors that get established in the first few weeks of university tend to maintain right through, even up to graduation. So getting that transition right, and that's really important within the curriculum, because again, how students engage with the curriculum, how connected they feel, how confident they are, and making sure that we're scaffolding the curriculum so that we're building skills, so that wherever students have come from, they're not being disadvantaged by the background. They're getting the opportunity to explicitly develop the knowledge, understanding, and skill that they need to be successful in their program. We need to look at learning, teaching, and assessment, building on that last point. How is it that learning and teaching and assessment support learning and well-being? And those 2 things are not in conflict. Really important. We can perceive conflict, and students and staff may sometimes believe that there is conflict there, but when we explore this, actually, challenge is good for students, but it needs to be challenge that's clear, that they understand, and that they're equipped to respond to. And that needs to happen within the curriculum. And then progression. How are we supporting our students from first year into second year, third year, perhaps fourth year? How are we supporting them into the world outside university or on into further study? Within support, we absolutely need to be looking at the support services that are available for our students. This is specifically looking at support for students within support. So again, all of those key criteria and principles of good practice around support services, making sure that they are accessible, that students can get them when they need them, can get the relevant support that they need, that we're ensuring we're providing the right quality of support, that mental health support is provided by trained qualified staff, that we have good clinical governance in place. Looking at the way in which we manage risk and recognizing that risk isn't something that's just managed by student services. It's something that we need to be responding to right across institution, but that the right people need to be managing it at the sharp end. How we work with those external partnerships and pathways, partners in in NHS and social care, and also in third sector and charity sector? How are we linking out to all of those other partnerships and pathways to ensure that our students are getting cohesive support within and outside the university? And what are we doing around information sharing? Are we confident? Are we sure about the way in which we share information, about why we would share information outside the institution? And are we clear that our students know what that is so that they're making informed choices about what information to share with us? In terms of work, staff wellbeing, as we stress throughout the framework document and all of the work that we do, staff wellbeing is important in and of itself. Staff are entitled to good mental health and wellbeing, and to being supported to have good mental health and wellbeing by the environment that they're in, by the resources that they can have access to, by the support and development that they receive. So staff wellbeing in and of itself, really important, and a challenging one, I think, for many universities about how we tackle this, because this reaches out beyond just the workshops that we provide and the support that we provide to the environment and the culture within which our staff are working. And looking at those areas around staff development, first of all, to support their own wellbeing, but also to make sure that they're able to respond to students when they need support with their wellbeing, to ensure that staff are able to work within their boundaries safely, but still make sure students get access to the support that they really need. The live environment, which really then looks at the whole environmental issue. So how are we providing those proactive interventions in that mentally healthy environment? What's going on in areas where students are living? How do we ensure that social integration and belonging for students and staff reaches out to everyone within the community so that people aren't isolated, that it is a proper inclusive environment that really brings everyone together so that everyone feels their sense of purpose and belonging? And what are we doing about that physical environment? Now, we recognize that, many universities have got old buildings and there's limits to what you can do. We're not expecting you to work miracles. But the question is, what are you doing within the physical environment as best you can to promote good mental health and good well-being? And then those enabling things that build underneath everything, that provide those foundation stones: leadership, strategy, and policy. How do we ensure that mental health policy isn't just existing in one document? How is it reflected in all those other policies and procedures that cut right across university life? All those things like learning and teaching strategies, or disciplinary policies, your regulations, your staff development policies, all of these things. How do we ensure that mental health and wellbeing is core and is thought about through all of that? How do we ensure that student voice and participation and co-creation are embedded into everything that we do across the institution, including the design of student services and how they're provided? How do we ensure that the support that we provide is cohesive? Universities are big, complex organizations, often with diffuse centers of power and control for good reason. But students only have one experience of university overall. They don't have departmental experiences. So how do we ensure that when a student needs support, they get it in a way which just flows seamlessly, so that there aren't gaps between different parts of the university, different services, between academics and student services, so that students are able to get that support, and so that colleagues who are then maybe in academic roles can be confident about signposting, knowing their students are going to get the support that they need, and then stay within their own boundaries so that they themselves stay safe. How do we ensure that our entire environment is inclusive? How do we ensure that we're reaching out right across our community to make sure everyone feels safe, has a sense of belonging, has their well-being supported, and can access services that feel that they understand them and their experience? And then the last one, which is about, this isn't necessarily about the kind of rest stuff and research. It's about research into the mental health and well-being of our communities, and innovation in terms of developing new ways of responding, developing new resources, new support services, new proactive outreach. What are we doing around that, and how are we sharing that across the sector? And some of that will be what we're hoping to do in the discussion that we all have together. When we're sharing that good practice, when you're developing your good practice, testing it, evaluating it, figuring out what worked and what didn't, and then bringing it into our discussions and sharing it, that will all help you to meet the terms under the research, innovation, and dissemination. So if you're not a research producing university, that doesn't mean that this thing doesn't apply to you. It's not about research culture. It's about what are we doing and how are you helping to develop the understanding of the entire sector about student mental health and well-being. So even if you're a small specialist, if you've been trialing things with your students and gathering data about how well it works, and then taking opportunities to share it with other colleagues and maybe with other small specialist institutions, that is something you can put into your charter award application, because that is the sort of thing that we're looking for. We want to work together to build all of our understanding of what it is that we need to do in order to improve student mental health and well-being on the mental health and well-being of our staff, so that all of our communities are communities where mental health and well-being is supported, where it's good, and where when people do experience problems, they get access to services when they need them that really are effective and really help them. So that's a kind of whistle-stop tour of the way we've tried to approach whole university within approaches within the Charter Framework document itself, and the way we'll try and view them within the award. And as I said, there are a number of ways in which you can explore that and think about it. Well, we would like you to do in advance of coming to the workshop is just to think about some of these things, because these are going to be topics of conversation. So first of all, how well do you think your current approach covers all of these dimensions and themes? And don't worry if there are gaps. Don't worry if there are areas where you still need to do work. We completely expect that to be the case. We don't think any university in the country is really stretching across all of these themes and dimensions yet. And that's okay. The Charter Award is designed to be stretching and to be challenging and to help us all develop and improve what we're doing. Who do you think needs to be involved in any whole university approach? And that's a really important question. And I want you to think really about right across the institution in terms of across different departments, but also to think down, to think about where your expertise is, because it may not be heads of department who necessarily have the expertise you need. So when we're thinking about whole university, who do we need to bring in? Who might be useful? We really want to hear about what successes you've had so far, what you found has worked. How have you brought colleagues together? How did you persuade people to get involved? How did you motivate people and get that enthusiasm? And particularly, how did you manage to engage leaders within your university? And we know people have gone about that in different ways. So we really want to hear about that. And in the session itself, we're going to share with you some resources from different institutions and colleagues at different levels, some VCs, some heads of student services and so on, who will share with you how they managed to do all of that. And when we come together, we'll have discussions about all of this. So hopefully all of that's useful. Do please go away and have a think about those questions, so that when we come in to have those discussions, you're ready to go and we can have some really informed discussions. And hopefully all of that will stretch all of our thinking and all of our understanding, and we'll all go away feeling that we've learned something. So I hope all of that was really useful. I look forward to seeing as many of you as we possibly can get into the online session. And good luck with all of it. Good luck with the work that you're doing. Thank you for continuing to work with all of this, with everything that's going on. We know universities are busy places, and we really do value the commitment of staff and students in our universities to mental health and well-being. So thank you for all of that. And I look forward to seeing you all in the workshop very, very soon. Thank you.